This is Friday night, November 21st, 2014, and I am JTG, James Thomas Green. JTG's my initials. Was that pedantic to say that? Maybe. But I'm sure at least a few people watching this went, JTG, what's that mean? Even though I said my name right afterwards. Yep, some people are slow. And speaking of slow, it's been quite a week. Had surgery yesterday, the second surgery in my life, although by comparison with the first, there was no comparison. I had a piece of my skin taken off my back, about, so I guess you would say, from what the doctor described, think of it as like from this knuckle joint to the end in length and about that wide, maybe a little wider in the back, in my back. There were two little spots there, and they weren't really spots, they were little, I don't know what they were. They were bumps, growths. And he cut all the way down, as he said, through all the layers of the skin, down to the fleshy part. Then he kind of had to carve away somewhat underneath it, I guess, in order to be able to pull my skin together and sew it together. Surgery was done at Natividad Medical Center. It was supposed to take about 30 minutes, according to what they told me in the start, but I was in there for an hour and a half. And by the end, I was hurting, not from the surgery, but from laying there. They told me that I would not remember anything. See, they gave me kind of a... They said I'd be conscious, but I wouldn't remember, because one of the drugs is Versed, which is supposed to make you forget things, and it's one of the drugs that made Dad go into his coma in 2000. But, you know, it was supposed to be a general sedative, mix of cocktail of drugs, and then they did a lot of local to cut it around, so it'd be numb around the area that I was being cut on. And so, well, they took it out, they sewed it up, and the two spots had become painful. They were near constant pain. And especially when I bent over or when I laid down, getting in bed, just getting in bed was very painful, and often I'd kind of delay going to bed for quite a while. And so, I'd stay up a lot later than I want, just because I knew that I was going to have to go through that flash of pain, and then every time I rolled over in the night, the pain would be enough to wake me up. So last night when I came home, when I went to bed, when I got into bed after months of having that pain, because these things have been here for several months, I was almost surprised there wasn't as much pain. I mean, I've got the pain from the thing in my back, and it's actually now more of an itch, and last night it wasn't really painful at all. So I'm glad they did it. I was nervous about it, and I'm still a little nervous because my biggest problem here is infection. Hopefully I won't get an infection. That would not be good. So I'm supposed to go back Monday. I was hoping to get my aunt, Janet, to come and pick me up at the hospital, and she's picked me up a few other times when I've had things done at the hospital, but this time she had something going on and she couldn't come pick me up. And so after asking around and getting people saying, I can't do it, I've got to work, or I got to do this or that, or don't have a car, I don't drive, eventually I found a woman from my time at CSUMB, Robbie Cunningham. I don't remember what her maiden name was, but she came and picked me up, and then we went and picked up her son at school, and then we went to go get my painkiller, and then I had to pick it up at the CVS pharmacy for some reason. I guess the stockholders at CVS had a pull over Natividad, so they managed. So instead of doing the logical thing, walking out of the hospital with the pills that I need, I have to take this side trip, which I could see could be a problem if I hadn't been able to find somebody, or for somebody that doesn't have, or he has to go pick them up and you're kind of stoned. So or hurting from the surgery. Anyway, 2 weeks I'll find out, biopsy, whether or not it's cancer. The doctor is almost certain it is not. He did mention a couple of things that are concerning. He said I had a white cell count of 15 and it's supposed to be under 11. But he said 15 is not like terrible and it wasn't enough for them to stop the surgery. So I'm wondering what he said. That could be a sign of an infection, but I've looked and that could be a sign of several other things. It could be a sign of just stress will do it. And I've certainly been under a lot of stress the last couple of months. Dad in the hospital, dad in nursing home, just the general daily life interactions with people. So I don't want to get too much into that here, but I'll talk about it at another time. And that's all for now.